This lecture is going to be in our ebook that is Chapter 7, Point of Care Testing. We've already touched on point of care testing, so this won't be a super long lecture, but you are still responsible for reading the entire chapter of Chapter 7. So of course, our key terms, we want to make sure that we are understanding them, that we know these as vocabulary words. If you want to look at it that way, I encourage you to make flashcards or whatever is going to help you understand and know these terms and words for your national certification exam. Once you start working, day to day as a phlebotomist, they will be second nature to you, but until then, they are words and terms that you do need to know and understand. So as we talked about previously, point of care testing, also called what? Does anyone remember? CLIA waived. Okay. Point of care testing and CLIA waived testing are the exact same thing, just two different terms, but you will see them used interchangeably. So you'll either see POCT, that abbreviation acronym stands for point of care testing, or you will see it written as CLIA-waived, CLIA waived. So you may work with some people that have been phlebotomists for a really long time, and they learned to call what we know point of care testing as alternate site testing or bedside testing are the two really common terms that were used until they came up with point of care testing. So it's not that they're incorrect, they're just older terms that's how someone learned. And just like you'll always call it point of care testing if it were ever to change, down the road in the future. So point of care testing can be done where the patient is. It isn't a lab test, or the specimen doesn't have to be processed in a lab, at a reference lab. It can be done right there where the patient is, no matter where that is, essentially for the most part. So a lot of times it'll be physician office labs, health fairs, walk-in clinics, long-term care facilities. It's a workplace screening, like just absolutely anywhere that you could think of. I could sit and make an exhaustive list, but that's not going to change the fact that it's anywhere that the patient is and is a safe and clean environment for you to do the testing. So point of care tests, you can have the same point of care test, we'll say a rapid strep test, from a multitude of different manufacturers. It's all testing all of those manufacturers' product for strep A are going to be testing for the same thing. However, how the individual manufacturer's test device is used may be a little bit different. So we'll get into that in just a few minutes. Here are some of the common point of care tests, or what's being tested. The laboratory department. I'm not going to go down through all of these, but you do need to kind of read these and be familiar with them generally. Most of them may make sense to you as we are, nearing the end of your program. The advantages and disadvantages of point of care testing in a nutshell. Point of care testing advantages is that you're able to meet the patient where they're at, easy to use. You don't have to be laboratory trained, though should be an allied health professional. You don't have to be specially trained. Usually they're cost effective. It doesn't overload the lab, and there's a decreased potential for specimen handling or process errors. And these are in compliance with CLIA, who is what? Clinical Laboratory Improvement Act. So they are CLIA waived, meaning that they are on a list of types of tests that CLIA says do not need to be processed in a reference laboratory for analysis. Disadvantages, though I don't like the term disadvantage, it's just things that need to be taken into consideration. So there's still the location that's doing the testing, whether it's a physician office laboratory, wherever that entity is, they still need to be accredited. They still need to do a CLIA application, to be a CLIA waived, lab or facility. So that still has to happen. Patients still have to be charged or billed. There still needs to be documentation of the patient results. Quality control testing has to happen. And then there's inventory management, because point of care testing are going to be individual tests with then some other stuff that goes along with it. So again, not a disadvantage, but just things to keep in mind. The phases of laboratory testing: pre-analytic, analytic, and post-analytic. Now, these are interchangeably the same as pre-examination, examination, and post-examination. So what does that tell you by breaking down these words? That examination and analytic are the same. You need to know the terms as either one, because you could see either one on your certification exam. It could say pre-examination or it could say pre-analytic. You need to know that if you see pre-analytic, that you're like, okay, yes, that's pre-examination before I do anything with the patient. So we'll just dive into these a little bit. Pre-examination phase. Who can tell me without reading what is the number one thing we need to remember when we are getting ready to do a lab test? Doesn't matter if it's point of care. It doesn't matter if it is in a patient collection, if it's in a hospital. What are we going to always, always, and forever have as our number one concern? Yes, patient identification. 2 identifiers. Know that, love that. Patient identification is 2 identifiers, always and forever. And what are the 2 most common identifiers that we use? Full name and date of birth of the patient. And who's going to give us that information? The patient. That's right. And if they can't, if it's a family member or a friend in with the patient because the patient is physically or intellectually unable to, we are going to document who that individual is and their relationship to the patient. So yes, patient identification is very important. So with that is part of the pre-examination or pre-analytic phase, is patient identification, because it is before the specimen is collected. So pre-analytic is before specimen collection. So we need to make sure that we are, looking at all of the things with that. You need to identify the patient. You need to make sure that, you have everything that you need to do. During the examination phase or the analytic phase, this is the actual test being performed. You must follow the specific manufacturer's instructions. So like I alluded to, multiple manufacturers can produce the same point of care test to test for the same. So we'll use flu A, influenza type A, or AB, flu test. Multiple manufacturers all have flu tests. So wherever you work, they typically order from the same vendor. So it's likely going to be the same. However, budgets happen, people run out of supplies, they have to use a different vendor. You may get a different manufacturer's flu test. Essentially, it's going to be the same as far as how you obtain and test the specimen. But you do not know that for sure until you read the manufacturer's instructions, and all the packaging boxes or whatnot will have instructions. Sometimes they'll be printed right on the inside of the top of the box so that it stays attached to it. But just make sure that even if you think, oh, I've done flu testing for the last 5 years, just make sure that any reagents, drops that you need to put in to get the test going, maybe it's 2 drops instead of 3. So those are all things that could cause error during the analytic phase if you're not following the manufacturer's instructions or you don't remember how to use it. A lot of tests you will do day in and day out and you will be very familiar. There may be some tests that you're like, haven't done this one in a while. So you want to refresh yourself, and that is okay to do. You don't do that in front of the patient, but you would know what is being done. So you would just need to kind of look at it that way. During the post-examination phase, post-analytical, that's going to be the interpretation and the documentation of those results. So one of the most important things here is, for whatever you're testing, you should know what those normal or WNL, within normal limit ranges are for the particular test. Because the last thing that you want is, if you're testing a patient's blood glucose level by point of care testing, which would be a dermal puncture, and it pops up 300. You need to know that 300 is a critical range, or a critical result, rather. So that critical value, you need to make sure that you're reporting immediately and knowing what steps, the provider who ordered the test wants to do with or for that patient. If you just document it, let the patient go on their way, and they go into, diabetic shock or diabetic coma because their sugar is sky high, and it's because you didn't let a provider know, there could be some repercussions with that. So point of care results are typically qualitative, semi-qualitative, or quantitative. So qualitative are going to be positive or negative. And that just tells you, is the whatever substance, chemical, whatever's being tested for, is it present or not present? So common things that we'll see that's qualitative would be a pregnancy test. Urine is put onto the pregnancy test. It's qualitative because it's either going to report positive or negative. Instant drug screens, that's where the patient urinates into a testing cup, and it would have the test strips on the side of it once it's activated. And as that is activated, you would be able to see within a couple of minutes if the patient is positive or negative for the various substances, or in this case, drugs that are being tested. Semi-qualitative are reported by how intense the reaction is. +1, +2, +3, things like that. A lot of times that would be urine dip. So the patient would urinate into the specimen cup, and then a reagent strip is dipped into the urine, and then it is read by the intensity. So there could be +3 white blood cells or +2 blood present in the urine. So again, semi-qualitative. Yes, it's a positive or a negative. You know that there is some present, but how present is it is the intensity. And then you have quantitative. So those are going to be a numeric result, something that spits out a number to you. So the example that I just used, blood glucose, if it shows a result of 300, whatever the number is that spits out, that makes it quantitative. So qualitative, positive or negative. Semi-qualitative, intensity, 1 +1 +2 +3. And then quantitative is a numeric result. So just know those three and kind of what the difference is between those three. We talked about critical values, quality control. So you do need to know QC is the abbreviation for quality control, and that's part of your quality management system. So this is making sure that the tests being performed, however they are being run, whether it's a handheld point of care testing device or larger reference laboratory equipment, need to make sure it's accurate and precise during specimen processing. So you always want to have a control specimen, how that's done. So external controls, those are tested in the same way that a patient's specimen is, and they're used to verify the test system, okay, that use blood or urine. So that is going to be the external controls for those are going to come from the manufacturer, and you would know on the device that you're using how to do the external control, add that, and make sure that everything is working properly. These are some logs. Your internal controls are contained within the test system, and those are procedural controls. So in test kit systems, they may, you add reagents to the device, and it's going to tell you, yes, everything is working good, or no, it's not. Internal controls need to be done with each test. So that is to ensure that that test is working before you actually test the patient's specimen. You can read about the individual quality control plans, the documentation of quality control. It is very important that it is documented. Usually it's going to be electronically. Smaller physician offices or, some places may have a paper quality control log. So you can see this is, a quality control log for urine dipstick. Common point of care errors. Typically, it's going to be from not following the manufacturer's instructions correctly. So this could lead to incorrect results, which again, we've talked about. Incorrect test results can cause incorrect treatment based on those results. Okay. Whether it's the patient not being treated because they don't appear to have whatever they were being tested for, or to be mistreated because the results are not accurate or elevated. So again, number one thing we need to do, patient identification, full name and a second identifier for all specimens, requisition forms, reports, always and forever. Collecting the specimen the right way, storing of test supplies. Some things need to be refrigerated. Some things need to be kept out of light. You need to know that. Quality control, that you're performing and documenting the quality control as it's required. And then you're actually putting the specimen or applying the specimen to the test device and performing the test correctly. Okay. So here are some of the common errors that are associated with different point of care testing, and you can, read those and go through those. We will talk about them more in lab as we practice these. Safety, yes. So pre-analytical phase failure. These are examples of the negative outcomes of procedural errors. So wrong patient, don't label the specimen, failure to collect the specimen in a clean container, quality control, failure to read the test strip correctly, or if you read it too early or too late, the instructions will tell you at what time frame do you need to read the results. Sometimes you have to wait 5 to 8 minutes. Sometimes it's 30 seconds to a minute, but no later than 5 minutes. Definitely need to understand that. So your frequent test glucose monitoring. These are glucometers that you see here, your testing strips, and then these are your quality control reagents, the little bottles. HemoQ, for testing the hemoglobin, you use a cuvette. You're not using that to break the skin. You can see how it's pointed in glass. You would still use a lancet, but this is what the cuvette is, what you would put the capillary blood into, and then it goes into the HemoQ device. And then just some of the testing things. White blood cell count, blood coagulation testing. So that's your pro time. Looks like a glucometer, doesn't it? It's not. So it's important that you know what you're using. So again, lots of different little devices, some handheld, some will sit more so on a counter, some will print off the results, others it will just show up on a screen. Cholesterol check. And this goes into the cartridge. The blood goes on the cartridge. You push the cartridge in and it will read out and print out results if you have one with the printer. PCR testing. Where have we heard PCR testing before? COVID testing. Okay. There are other types of PCR testing, but for our, prior knowledge, that would be, most of us are familiar with the PCR testing from COVID. So quality management for lab testing is comprehensive. Quality management is the overall process. There are written policies and documented actions to evaluate the entire testing process, from test order through specimen collection and reporting of results. So you need to know that. Okay, that is it for chapter 7. I think I will do chapter 8. Let me just see, vascular access device. I will do that as a second lecture.